Okay, then this is head of femur which articulates with the hip bone to form
Ball and socket.
acetabulum of hip bone to form the ball and hip joint. Okay, then uh, this is thigh, then leg. Okay, in the thigh it is divided into three compartments: anterior compartment, medial compartment, posterior compartment. Okay, by two intramuscular septum, medial and lateral intramuscular septum. Thigh is divided into three compartments: anterior, medial, okay, then posterior. In the anterior compartment you see how many muscles? Quadriceps femoris. Okay, four muscles. That is rectus femoris. Okay, one is rectus femoris and vastus medialis, lateralis, intermedius. Okay, this is intermedius. Vastus intermedius. Rectus femoris. Okay, then vastus lateralis and vastus medialis. This is vastus medialis. Okay, and this is intermedius. Just rectus femoris
Femoris.
below intermedius. Vastus lateralis, medialis, rectus femoris. Okay, what is the importance of rectus femoris? Some injections.
Insulin.
Insulin also some injections in vaccines given on the rectus femoris. Okay, this side. Then this is iliotibial tract. Iliotibial tract. This is iliotibial tract. Gluteus maximus. Okay, 3/4 of gluteus maximus and tensor fasciae. Two muscles are inserted into the iliotibial tract. Iliotibial. This is tensor fasciae and this is gluteus maximus inserted into the iliotibial tract. Okay, then these four muscles are known as quadriceps femoris. Quadriceps femoris action is extensor of hip joint, extensor of knee joint and flexion of hip joint. This quadriceps femoris. Then come to nerve supply is femoral nerve. Nerve supply is femoral nerve, anterior compartment. Okay. Then come to medial compartment. Medial compartment, adductor, this is adductor longus, this is adductor brevis and this is adductor magnus. This is adductor magnus. Okay, adductor longus, brevis, adductor magnus. Okay, this is and also gracilis. This is this is sartorius. This is sartorius. This is sartorius. Okay, muscle of anterior compartment. Okay, then this is adductor longus, brevis, magnus. Okay, these are and this is gracilis. This is gracilis. These are adductor compartment muscles and supplied by obturator nerve. Anterior and posterior divisions of obturator nerve, adductor compartment. Okay, then and function is adduction of hip joint, adduction of hip joint. Okay, then come to posterior compartment. Posterior compartment, your semitendinosus, semimembranosus, posterior compartment. Okay, semitendinosus and semimembranosus. Then your asibo next asibo biceps femoris. Okay, biceps femoris, semitendinosus, semimembranosus. This is semitendinosus, this is semimembranosus, and this is biceps femoris. Okay, and this is popliteal fossa. ये तुम्हारा in the hand cubital fossa is there. Okay, here like popliteal fossa. This is popliteal fossa. Popliteal fossa. Popliteal fossa. It is bounded by biceps femoris and semimembranosus, semitendinosus. Okay, and two heads of gastrocnemius. Two heads of gastrocnemius. Okay, this is popliteal fossa. Okay. Then posteriorly, the muscles are supplied by sciatic nerve. This is sciatic nerve, largest nerve, that is sciatic nerve. Okay, this is sciatic nerve, and in the popliteal fossa it divides into tibial nerve, common peroneal nerve. Laterally, common peroneal nerve, and middle tribune. This is tibial nerve, sciatic nerve. This is sciatic nerve. Okay, divided into tibia in popliteal fossa, tibial nerve, common peroneal nerve. Okay, so posterior compartment supplied by this sciatic nerve. Okay, then and again anterior compartment, thigh, quadriceps femoris and sartorius. Okay, this is the sartorius. Then anterior compartment muscles. This is rectus femoris, vastus, lateralis, intermedius, then medialis. Okay, then they all are inserted into the patella. Okay, then this is sartorius, inserted into tibia, medial surface of tibia, sartorius. Okay, then come to and supplied by which nerve? Femoral nerve. Okay, femoral nerve. Then adductor compartment, adductor longus, sciatic nerve posterior compartment. तापर medial compartment रे तमरा आसीबो adductor longus, brevis, magnus. Okay, and gracilis. This is gracilis. Okay, gracilis. They are supplied by which nerve? Obturator nerve. Okay, obturator nerve. Then posterior compartment. Okay, semimembranosus, semitendinosus. Okay, and biceps femoris. Semitendinosus, ये टेंडन है, semitendinosus, ये membranosus, and biceps femoris. मतलब एमती जानबो सुनो tibia रो medial side. This is tibia रो medial side. 3 muscles are inserted. One is sartorius, gracilis, semitendinosus. ये जो टेंडन नहीं ये छिड़ी है टेंडन टा. तो all 3 ये असला ये असला ना देखो sartorius hala, then gracilis, then semitendinosus, all inserted into medial surface of tibia hala. sartorius, gracilis, semitendinosus ये जो टेंडन टा hala. तो ये टेंडन टा तमरा छिटी एठू टेंडन टा. Okay, semitendinosus, semimembranosus. Semitendinosus, why it is named as tendinosus? Because insertion, lower part is tendon-like. Why it is semimembranosus? Origin part is membrane-like. So semimembranosus, semitendinosus. Then this is biceps femoris. Okay, semi-mandrella. So this is popliteal fossa. Popliteal fossa is bounded by semitendinosus above. Semitendinosus, semimembranosus, and laterally biceps femoris. And below lateral head, medial head of gastrocnemius. This is gastrocnemius muscle. Okay, and posterior compartment of muscles supplied by, this is flexor of knee joint. These are flexors of knee joint supplied by sciatic nerve. Okay, then sciatic nerve in popliteal fossa divides into tibial nerve, common peroneal nerve. Again common peroneal nerve at the neck of the fibula divides into superficial peroneal nerve, deep peroneal nerve. Superficial peroneal nerve and deep peroneal nerve. Okay, and tibial nerve comes downward and continuous as tibial nerve. Okay, then come to leg. Leg has anterior compartment, posterior compartment, and lateral compartment. Thyre thila anterior, posterior, medial. Leg raibo anterior, posterior, lateral. Okay, then come to anterior compartment. Anterior compartment you get muscles. Tibialis anterior. This is tibialis anterior. Okay, tibialis anterior. Then anterior is extensor, but in hand posterior is extensor. Posterior सब extensor muscle पाइथिलो ना hand रे upper limb रे, but in leg anterior compartment has extensor muscles, posterior compartment has flexor muscles. Okay, so you get one is tibialis anterior, medial to lateral, tibialis anterior, then this muscle is extensor hallucis longus. Okay, extensor hallucis longus, then extensor digitorum longus. These all tendons. Okay, extensor digitorum longus. हाँ, ये भी muscles of origin is tibia fibula. Okay, then extensor digitorum longus, then peroneus tertius or fibularis tertius. Okay, peroneus tertius. Okay, now in the anterior compartment you get 4 muscles. Medial to lateral, one is tibialis anterior, then extensor hallucis longus, hallux great to hallux. Okay, so extensor hallucis longus, then this is extensor digitorum longus. It spreads tendons to lateral 4 toes except toe, because hallux is already one muscle. Okay, so extensor hallucis longus, these tendons, extensor digitorum longus to lateral foretoes, these tendons, extensor digitorum longus, then peroneus tertius. This is peroneus tertius to the base of the fifth metacarpal. This is peroneus tertius. Fifth metatarsal. Fifth metatarsal. Okay. This is peroneus tertius. And nerve supply is your deep peroneal nerve. This is common peroneal nerve. This is common peroneal nerve. Okay, divided into superficial deep. Deep peroneal nerve comes and supplies these muscles. Deep peroneal nerve. Okay. Then lateral compartment. Lateral compartment has two muscles. One is your peroneus longus, one is peroneus brevis. Longus means long. Okay, peroneus longus, one is peroneus longus, one is below this muscle. This is peroneus brevis. Small. Brevis means small. Peroneus longus, peroneus brevis. Okay, this tendon is peroneus brevis and this is peroneus longus. Okay, peroneus longus and brevis, and they are supplied by superficial peroneal nerve, branch of common peroneal nerve. Superficial peroneal nerve. Okay, and anterior compartment muscles are supplied by deep peroneal nerve. Okay, then come to posterior compartment. Posterior compartment again has superficial muscles, deep muscles. Superficial muscle, there are three muscles. One is gastrocnemius, lateral and medial heads of gastrocnemius, and soleus. Here तले जो muscle देखो, this is soleus. These are two heads of gastrocnemius. These are two heads of gastrocnemius. These are two heads of gastrocnemius, and below you get the soleus muscle, and also you get the plantaris muscle, lateral side. Below you get another small muscle, that is plantaris. This small muscle is plantaris. Okay. This is plantaris. Small muscle, very small muscle is there, plantaris, and then these tendons is these two muscles, gastrocnemius, soleus, plantaris, known as triceps suri. Tricep, three, okay, triceps suri, collectively known as triceps suri, and this tendon is known as calcaneus tendon or tendo Achilles. Tendo Achilles or calcaneus tendon. Okay, this tendon is formed by muscles of gastrocnemius and soleus. Okay, then deep muscles. Deep muscles you get posterior flexor compartment. Posterior is flexor compartment. You get tibialis posterior. Okay, flexor digitorum longus, flexor hallucis longus. You get three muscles in the posterior deep group of posterior compartment. Okay, so again deep muscles are, one is tibialis posterior. Tibialis posterior, this is medial malleolus. Okay, just behind the medial malleolus you get the tendon. So come to posterior compartment, deep muscles, tibialis posterior. Okay, tibialis posterior, then flexor digitorum longus, then flexor hallucis longus. Then nerve supply is tibial nerve. All these gastrocnemius, soleus, plantaris, and these all are supplied by this tibial nerve. And here also in deep you get the muscle, that is popliteus muscle. Okay, in the deep just behind the knee joint you get one muscle, that is an unlocking muscle, that is popliteus muscle. Okay. Then clinical importance, you can measure also blood pressure at the popliteal artery which is present in the popliteal fossa, this artery. Okay, you can measure blood pressure, okay, in the popliteal artery. Also you feel the pulsation in the popliteal artery, and also dorsalis pedis artery here. just in between two malleoli, anterior tibial artery continuous with dorsalis pedis artery. You can also feel the pulsation in the dorsalis pedis artery in between two malleoli. This is medial malleolus, this is lateral malleolus. Okay, in between two malleoli, and this is extensor retinaculum to hold the tendons in position. This is extensor retinaculum. Also here lies the flexor retinaculum. Okay, flexor retinaculum. Here lies the flexor retinaculum. Here lies the extensor retinaculum. Another retinaculum. This is peroneal retinaculum to hold the two peroneus tendons, peroneus longus and brevis, in position. Okay. Then another is if veins are not proper seen in the upper limb, you can also here just behind the medial malleolus passes the great saphenous vein. Great saphenous vein passes just below the medial malleolus. So by venesection you can introduce the intravenous injection through the great saphenous vein also. Okay. हाँ ये डोर्सल पेडिस आर्टरी रहबो एठी ग्रेड एठी भी होउची आ ये रहला तुमरा कॉप्टियल आर्टरी ऑफ वेन ये रहला अवेलेबल फीमोरल आर्टरी फीमोरल वेन रही फीमोरल एठी तुमरा आसीबो फीमोरल आर्टरी फीमोरल नर्व फीमोरल आर्टरी एला फीमोरल आर्टरी ओके एला वेन हाउ कैन यू आइडेंटिफाई वेन आर्टरी सी वेन इज थिन वॉल्ड नीचे टच कले जान परिबो दिस इज थिन वॉल्ड वेन ओके आर्टरी देखो केते थिक वॉल्ड हेलो थिक वॉल्ड एंड सी द ल्यूमेन इन द आर्टरी एंड तुम धरले भी लागिबो ट्यूब लाइक सेंसेशन इज देयर हेलो धरले टच कले जान परिबो ट्यूब लाइक सेंसेशन बट वेन इज थिन वॉल्ड collapse the wall is collapsed and thin walled okay but here lumen is patent in the artery femoral artery continuous is popliteal artery okay and femoral vein continuous popliteal vein then divided into in the lower border of popliteus or in the popliteal fossa divided into anterotibial posterior artery okay and supplies the same anterotibial artery comes supplies the muscles of the anterior compartment, posterior tibial artery supplies the deep superficial and deep muscles of posterior compartment. Then anterior tibial artery continuous is dorsal pedis artery. Okay, dorsalis pedis artery. Okay. Then posterior tibial artery continuous and at the foot it divides into lateral plantar artery and medial plantar artery to supply the muscles of the sole. Okay, so these are the some clinical importance and muscles of lower limb. Hello. तो मैंने को रखो इधर मोबाइल vastus femoris, then vastus lateralis, medialis, intermedius medialis, and anterior compartment. Now supply है ला femoral nerve. ला higher three nerves मन रखो femoral nerve, medial compartment में obturator nerve, posterior में sciatic. मतलब femoral obturator sciatic एटा gluteus maximus तार importance है पूरा upper and outer quadrant okay then medial adductor compartment adductor longus brevis adductor longus है ला उठे देला small muscle brevis large muscle magnus nerve supply obturator nerve मतलब that's the gracilis then posterior compartment is semitendon like semitendinosus semimembranosus एपड़ा असला biceps femoris is two heads long head short head two heads and nerve supply आसो तमरो sciatic nerve then अपरा आसो एठी असला तमरो anterior compartment of leg okay anterior compartment is medial to lateral tibialis anterior then extensor is anteriorly extensor extensor hallucis longus extensor digitorum longus peroneus tertius nerve supply is deep peroneal nerve then lateral compartment two muscles peroneus longus peroneus brevis or fibularis fibula bone origin होची fibularis longus fibularis brevis भी कोई पे okay, and supplied by superficial peroneal nerve. एपट जो superficial एटा आसला superficial peroneal nerve आपको supply दे देला, then deep peroneal nerve anterior compartment को supply किया, deep peroneal nerve. Then posterior compartment रे superficial muscle, deep muscle. Superficial muscle रे हमारा आसला gastrocnemius two heads, soleus, एक होचा triceps suri, and tendon is known as Achilles tendon, tendoachilles or calcaneus tendon. Calcaneus tendon inserted into the calcaneus. Okay. Then plantaris, also small muscle is there, plantaris, and deep to you get the popliteus muscle. Then deep muscle is tibialis posterior, okay, tibialis posterior, flexor distorum longus, flexor hallucis longus. 8 tendons okay. Out ये तुम medial malleolus, this is lateral malleolus. ये gastrocnemius, ये soleus. Soleus को कहते हैं peripheral heart, because contraction of soleus pushes the blood from lower limb towards the heart through the intravenous. So soleus contraction helps. So it is known in the heart contraction. ये भी सिर्फ contraction.